HPV stands for human papillomavirus, and there's over 100 different strains of HPV. In fact, they keep finding more and more new strains of HPV all the time. Unfortunately, in my opinion, HPV is one of the most misunderstood concepts in all of medicine, and there is a huge amount of misinformation out there, even in what looks like reputable sources. And I think this really stems from the vaccine. Fortunately, there is a vaccine against HPV. The most common is, the most popular one is the Gardasil, and I'm a big fan of the Gardasil. I really think everybody should be vaccinated. However, I think that a lot of the misinformation came out from a public awareness campaign that came out a couple of years before the vaccine was introduced. The idea is it's hard to get people to want to use your vaccine for a disease no one ever heard of. And so in order to get people to want to use the vaccine, there had to be this fear of the disease that was put into the public perception prior to the vaccine coming out. So you get people aware of the disease, fearing the disease, you bring out the vaccine, and all of a sudden people want the vaccine. And I think that's where a lot of this misunderstanding happened. Now, HPV is a problem, and it certainly can cause problems for people, but it's not the nightmare or the monster that some people think about it. I see, when I tell people that they have HPV, I see how their face falls sometimes and how sad and depressed they get. And that's really not the right way to think about this. So in the United States, 85% of the adult population has HPV at some time or another in their lifetime. So if you think about it logically, if 85% of the population has it, it's really not something that you should be too upset if you have, because chances are you probably will. So there's only a 15% chance you're going to skirt through life without ever having HPV at one time or another. And so most people have HPV. And in fact, when I find out that a patient has HPV, all it really tells me is that they've probably had sex at some time or another. So if I have a nun come in and she has HPV, I'm going to be pretty surprised. Anyone else, not so much. And that's really the way to think about HPV. Now, HPV can cause problems in women. It can cause warts. It can also cause abnormal Pap smears and something called cervical dysplasia. If ignored over a long period of time, that can ultimately turn into a cervical cancer. But the good news is, with routine Pap smears and routine checkups, cervical cancer is almost unheard of. In fact, in the United States, there's only about 3,700 cases of cervical cancer a year, and the overwhelming majority of those are either in recent immigrants that haven't been getting Pap smears, or in women that for some reason or another haven't gotten a Pap smear in years and years and years. So women that come in for their regular annual exams pretty much don't get cervical cancer. There are, of course, some exceptions. It does cause dysplasia, which is a pre-cancer situation, but that's very easily treated in the office, and if treated, really shouldn't cause any long-term problems. Cervical dysplasia is really kind of what we're looking for when we do Pap smears. Warts are also easily treated in the office, and they're obnoxious and uncomfortable, but they're easy to make go away for the most part. Now, only some types of HPV cause abnormal Pap smears, and only some types of HPV cause warts. Most of those strains of HPV actually don't cause any problem at all. And so when we test for HPV in Pap smears, we really only test for those high-risk HPVs that cause problems, not the low-risk ones that just sit there and do nothing. In men, HPV causes even less problems. It is possible to get penile warts, but again, those are treatable. Penile cancer is extremely rare disease and almost never seen. I can think of only 1 or 2 cases of penile cancer that I've ever seen in my entire career. And so HPV really isn't a big problem for men. Now, it's still recommended that boys get vaccinated. The excuse is to avoid warts, but the real reason is something called herd immunity. And the idea is that if you vaccinate the entire population, those who the vaccine doesn't work on are still protected because the disease isn't around in the population itself. And so the idea is if you vaccinate boys, they won't have HPV on their penis, and it's less likely than that girls whose vaccines didn't work or didn't get vaccinated will get the HPV. So that's the concept. So it's a good idea to really vaccinate everybody. Now, our understanding of HPV is still really in its early stages. In fact, when I was in residency, we were doing some of the original research on HPV before anybody ever heard of it. And believe me, I'm not that old, so that wasn't that long ago. So this whole idea of HPV is still evolving. There's this idea of whether HPV is actually cleared, whether it comes and goes, whether there's reinfection, or whether it's just that it doesn't show up on tests, but still they're dormant, sort of like herpes kind of can come and go, but still really is present all the time. And really we're not sure which one that is. Now, from sort of a social point of view, what happens if you find out you have HPV? And my answer is really nothing. In my opinion, I don't think this is something that you necessarily need to disclose to a new partner, for example. So if you have HPV and you have a new boyfriend, I don't think it's something that you necessarily need to tell them that you have. It's not like if you have, HIV or herpes. That would be something that would be important to tell your partner. HPV, honestly, I don't think is a big deal where that needs to be sort of disclosed in early on in a relationship, because it really doesn't carry the same type of ramifications. And again, there's an 85% chance that your new partner also has HPV. And so I know it feels devastating for people when they hear that they have a diagnosis of HPV, but the truth is it really isn't going to change much or really anything about your life. It doesn't mean that your partner's cheating on you, because it's very likely that you've had that HPV for years and years and years. Again, all it really means is that you've probably had sex sometime in your life. So if you do have HPV, of course, you need whatever follow-up treatment the doctor recommends, but you really don't need to feel like you have the scarlet letter or some horrible blight on your body. This is, again, very common, and 85% of the adult population in the United States has this.
Medtwice.com